Do you want to know more about how you can eat for better health and longevity, and how your diet and lifestyle can play a part in chronic disease? Then you're in the right place. I'm Claire Day.
And I'm Daisy Lund, and we are both plant-based doctors with a passion for improving nutritional education. In this podcast, we will bring you all the latest medical evidence on how a plant-based diet can improve your health whilst being kinder to the planet and fairer to the animals that we share it with.
Twice a month, we bring you interviews from experts in the field with a focus on an important topic related to plant-based health, all while sharing recipes and food ideas.
So, welcome to, in a nutshell, the Plant-Based Health Professionals podcast. On this episode, we would like to introduce Dr. Laura Jane Smith, Consultant Respiratory Physician at King's College Hospital, London, who is also a qualified lifestyle medicine physician and has an interest in plant-based diets for the environment, health, and ethical reasons. Hello and welcome, LJ.
Hi, thanks so much for having me.
Oh, thanks for coming on. Before we start, I'm sure listeners would like to know a bit more about you. Can you tell us a bit about your background and about your journey to being plant-based?
Yeah, of course. So like most people I speak to, I grew up on a very standard British omnivore diet. I grew up in the Midlands and we had meat at almost every meal, lots and lots of dairy. And I didn't really know any vegetarians, never mind vegans growing up. And then at university, I met some vegetarians and they talked to me about animal welfare reasons. And I pretty quickly went vegetarian and then really didn't think much more about it until 2017 when I watched some films. I don't even know why, but I watched some films on dairy and egg industries. And then that was it. I couldn't unsee the videos of calves being removed from their mothers or like the day-old chicks being dropped into a macerator. And so a switch flipped and then I was vegan. And the only regret was that I hadn't done it sooner. And I've felt better ever since, really, because I'm living my values. The environmental impact of animal agriculture is also shocking, and so that's a really real motivator for me. And I came to the health benefits really late, so I didn't know anything about nutrition before, and so that's been a real learning curve. But I just turned 40 last year, so I'm starting to become aware that I really need to look after my body if it's going to look after me.
It's really interesting that you should say that, because as healthcare professionals, we all found the health benefits of a plant-based diet after the other benefits for the animals and the environment, obviously. So it is great, and that's what we're hoping to share on this podcast.
Yeah, I think it just shows what a big gap it is in medical education, and I would hope that that's starting to change, but I think we're a long way off, really.
Absolutely, we both agreed.
So you're a respiratory physician primarily, and what we really like to ask other doctors about is whether they speak with their patients about their diets and lifestyle. And one of the things in our introduction, we've mentioned that you're a lifestyle medicine physician. So can you start by saying a little bit about what it means to be a lifestyle medicine physician?
Yeah, so I started off doing the Winchester plant-based nutrition course, as lots of us have, to really upskill in nutrition. And I guess that led me into thinking more about this huge evidence base that I was completely unaware of, all these trials and epidemiological studies and just a wealth of evidence that I'd never seen on nutrition. And the same is true for other aspects of lifestyle. And I don't really like the word lifestyle, but they're things we do have control over, and they're not drug related. So, if you have good quality sleep, if you're active, if you have really important, good quality relationships, all of these things add up to health. And so I just wanted to know more and more about that. So I'm pretty motivated by exams and by someone sort of assessing me. So I decided to do the diploma to really push myself to read more. And that's quite a commitment. It's a lot of online learning. There's a case study. There's a conference to go to. There's lots of stuff to do, but it really gets you completely immersed in all of the evidence base. And so that's been huge. And I guess having done that, I've become more confident about talking about lifestyle interventions and nutrition in my clinics. I never used to mention food because I didn't really have anything to say. I feel a bit ashamed of when patients would ask me and I would have nothing to say to them. So it's still not part of my routine practice, and I'm looking at ways to change that, because if I'm in a COPD or a lung cancer clinic, it's not immediately obvious to bring up food. The patients aren't necessarily expecting it, but actually as soon as you sort of start looking for ways in, you see that there are loads. And actually patients do want to know what they can do, particularly actually with a cancer diagnosis. People say, what can I do while you're kind of getting through the tests and working up to treatment? And diet is something that they can do and they can have control over. So I don't think we should see it as an additional burden. It's actually empowering them to improve their own health. So I try to keep the messaging really simple, because it can get confusing if you give people too much information at once. So I tend to say, I tailor the advice to what the patient's asked, but I tend to talk about increasing the proportion of plant foods, reducing ultra-processed foods, meat and dairy. And I quite often use the Plant-Based Healthcare Professionals Eat Well Guide as a visual tool to say, what does your plate look like over the course of a day, and what shifts could you make that would really be beneficial?
Okay, thanks. I mean, is there any evidence to say that people with specific lung disease will do better with a plant-based diet? I mean, there's lots of anecdotal evidence out there, but if you were giving advice within your field, what would you feel comfortable or confident saying?
Yeah, I really wish there was more out there. There was more evidence. So we are quite behind. I'm pretty jealous of cardiologists and endocrinologists, even the rheumatologists. They've got really quite an evidence base for really transformative effects of a plant-based diet. So we do need more research in respiratory medicine, but there is some evidence. So COPD is one of my main clinical interests. It's the third leading cause of death globally after ischemic heart disease and stroke. And it's an inflammatory condition. So there's some evidence from meta-analyses that there's an increased incidence of COPD in those who consume what we would call an unhealthy Western diet pattern. There aren't really any large studies looking at plant-based dietary interventions for COPD, but the anti-inflammatory effects of phytonutrients are likely to be very beneficial. And there was one cross-sectional study that showed a lack of fruit in the diet was associated with a lower FEV1. So that's one of the measures of lung function. And a follow-up study actually showed that, again, those who reduced their fruit intake had a greater drop in lung function. So there's definitely something about fruits and vegetables and lung health.
That's really interesting, because I think that's a really simple fact that, say, nurses or GPs doing these COPD reviews can easily put that in as a bit of information. If you're able to say to a patient, you know, you need to eat more fruit, well, there's evidence that it could directly help you with your lung function performance. That's quite motivating, I think.
Yeah, because other than stopping smoking, there's not a lot that people have control over. So certainly dietary interventions, and they will only bring other co-benefits. So many of my patients have comorbidities. They've unfortunately living with overweight or hypertension, diabetes, ischemic heart disease. So these are only wins. In asthma, there's a growing body of evidence that diet influences development, severity, and progression of asthma, actually. And again, there's not much data on entirely plant-based diets, but there's definitely data on Mediterranean-style diets, which outperforming Western diets, which are heavy in meat and dairy. And interestingly, there's a large study, I think it's called NAMES, National Health and Nutrition Examination Study. It's a really big cohort study. And there is a kind of mini study within that looked at meat consumption and showed that it had an increased odds of wheezing. So they think it's related to these glycation end products, which I hadn't heard of before I started doing all my nutrition stuff. But it's really interesting once you start to look into this. So it turns out that there's these glycation end product things, dysregulation is already associated with lung cancer, fibrosis, and graft versus host disease after transplantation, all of which are inflammatory conditions. So we really need to dig down into this, because there's clearly a signal there that really needs further examination.
Yeah, I mean, that sounds really interesting. I think some of our listeners may be disappointed that some of their anecdotes aren't being backed up yet with evidence, but I'm sure we'll get there. Now, another subject that's really close to our hearts at plant-based health professionals is what's served up in hospital meals, and this idea that if you're served something in hospital and it includes meat, then we must in some way be saying that it's okay to have that. So you've been doing a lot of work to change hospital meals. Can you tell us about that?
I can, but how long have you got? Because it's quite a subject.
Yeah.
It's just fascinating when you start to try and unpick the problems with hospital food. So I do quite a lot of sustainability work in general. So I'm always trying to change the way we live and work. And we've made real headway at my hospital with things like inhalers, anaesthetic gases, air quality, but food is the hardest one by far. And it just shocks me so much because, we have people in my hospital who are there because they've just had a heart attack or they've just had a bowel cancer resected, and we're serving them bacon and sausages, processed red meat, with all the harms associated with that, with health, not just, never mind the environmental impact. There's absolutely no justification for this. And my hospital has a green plan, and yet, again, beef is such a massive contributor to greenhouse gases, land use change, air and water pollution. So it just is completely against the NHS's commitment to net zero. And I just find it really frustrating how much misunderstanding there is amongst healthcare professionals as well as kind of NHS managers, and how much opposition there is to constraining choice in any way. And this makes no sense because we already constrain choice for patients all the time. We don't let them smoke on the hospital grounds and we don't serve them high sugar drinks. So we take an approach that is health first, and yet we don't do that with what we're serving.
I was going to say one of the things that came out recently was your paper on what you'd found when you and some colleagues had actually run a questionnaire. Can you tell us more about what that showed up?
Yeah, so I work with Shireen at King's College Hospital. So the two of us have been trying to work on this together, and a medical student was really great and did a project where we asked lots of patients what they would think if we removed processed red meat or red meat from patient menus. And what we get told all the time is that patients would absolutely revolt if we did this. They would be shocked and horrified, and they would demand that immediately that we reinstated meat. And what our survey showed was that the majority, so more than 50%, I can't remember the numbers, 60-something%, said that they didn't mind, that either they were neutral about it or that they were supportive. We asked them specifically if they would be happy to do this for the reason of cancer prevention and health and the reason of climate change. And again, more than half both times said that this was totally fine. And we have to remember this is without any education program at all. This is just asking a random selection of people who are attending hospitals in South East London what they think. So I think that's not what people expect. And I think we don't give people enough credit for the knowledge they already have and the fact that they want to improve their own health and the planet's health.
Yeah. What struck me about that paper, though, was the point that you made earlier about people wanting choice. And there was still this kind of about 25% saying that they wanted to be given the choice of eating red or processed meat when they're in hospital because it was important or extremely important to them. So what do we do about that? The question would be, but if people have got the information, shouldn't they still have the choice to eat what they want to eat?
So no, because that's not how we run society or how we run our healthcare system. If someone wants to smoke on my ward, they can't. It doesn't make any sense. As healthcare organisations, we have to put our patients' health first. We can give them choice. We can give them plenty of delicious, nutritious options without serving them something we know is harming them. So yes, I'm very pro-choice, but that doesn't need to include processed red meat. And our patients' health and the climate crisis demands that we move away from this. And so, organisations like healthcare organisations have to be leaders in this. And actually, hospitals are so far behind. It's so frustrating because there's really great evidence on what helps people to make positive choices. So actually, if you do provide them with information, if you label things appropriately, and if you actually serve food that's nice, that's delicious, that's not boring and flavourless, then they will opt for those things. And there's loads of public sector organisations already doing this. Schools, councils, universities up and down the United Kingdom have all made huge progress, and yet hospitals are embarrassingly far behind.
I mean, when you were giving patients options on that survey, one of the things that was disappointing for me was you gave patients the choice of what they would eat instead of red meat if it was taken off menus. And obviously massive, I think it was something like 65% said, oh, I would have chicken or fish. And very few opting for soya protein and tofu and beans and lentils. So what can we do to make those changes in hospital, do you think, to get people more familiar with or fancying those choices?
So I think that's exactly it. It's about familiarity. So if you ask the average person in Southeast London who's in hospital, that cohort of people are not likely to be people who eat a lot of plants already. They've got massive health problems. That's a reason they're in hospitals. They're much more likely to have dietary driven health problems. So their norms are going to not be soya, beans, lentils. They might not have ever tasted these things. So giving them that choice, blankly on a piece of paper to say, what would you choose? Of course, they're going to choose familiar things, chicken and fish. And also what they're being served in hospital now, the vegetable dishes are pretty rubbish. So I would not be enthusiastically choosing them either. So if we're presenting people with really inferior choices in terms of deliciousness, then of course they're going to choose the things they like. However, we've seen in the New York program that actually you can make change if you're much bolder and if you have the right messaging. So if you just go plant-based as default, as they have done in New York hospitals, then it's been massively well received, and it's also helped to educate staff and patients on the nutrition benefits. So there's huge potential. So if NHS England decided they actually wanted to take this on, and if healthcare organisations actually committed to support the health of their patients, then they would follow the evidence and they would make these changes, and they would provide adequate resource to be able to make it successful.
This is true. And I think NHS England, if you're listening, I know that you're always looking to save money. So we might just have the answers for you. Okay, I'm going to ask you just briefly, were you involved in No Meat May this year?
Yes. So, as I said, Shireen and I worked together at King's, and over the last few years, we've been promoting meat-free and plant-based foods, both as part of a group called Plant-Based Kings. And so we do No Meat May and we do Veganuary each year. And No Meat May is really great because it's just that bit more accessible to people than Veganuary, which to some people feels like a bigger jump. And we focused on staff because we're only two people and there's only so much we can do. But if we can support more staff with education and support, they're more likely to then give better advice to patients. So also NHS staff diets are, from large surveys, not great. And so it's also a well-being issue. So we've done webinars, cook-alongs, we've had stalls. We've made a plant-based cookbook with recipes from staff at King's, which I think makes it really real to people that this is for them. It's not something for like strange people, it's for everyone. And we share tips. So every day in May and January, through a WhatsApp group, we share information on the environmental impacts of animal agriculture and plant-based foods, and stories, articles, recipes, restaurants. So it's fun.
And have you had any influence over what's been served in the canteen during those months?
So we've tried things like meat-free Mondays and entirely plant-based days for Earth Day, but the offerings from our canteens are not great, and the people that go there expect a very specific thing, and also the pricing is pretty high. So there are lots of other factors that mean it's quite hard to make that successful. Our catering is all outsourced, it's not under the control of the hospital. So there are lots of other reasons why that's a challenge. But we have had good feedback, and we have had one real success story. So Claire, who's a member of staff, went from being omnivore to vegan due to the information that we've shared. And she is now part of Plant-Based Kings, and she's an incredibly fantastic advocate. So she's our real success story, and I hope there'll be many more.
Fantastic.
That's really lovely to hear, LJ. If the listeners want to reach out to you to get some help with a similar initiative for their own workplaces, can we link your details in the show notes?
Absolutely, yeah. We'd be really pleased to support anyone else who'd like to do something similar.
Fantastic. And just changing the direction of our question slightly, we want to sort of delve in a little bit more about the link between our diets and air pollution and climate change. We know you've done a lot of work on that, including a podcast that you've created with a section on climate focus. Can you tell us a bit more about that?
Yes. So Journal Spotting is the podcast. It's a general medicine podcast that is run by two registrars in cardiology and respiratory, John and Barney, and they do kind of general medicine updates, conference highlights, interviews. And they had the idea of doing a mini-series about climate and health called Climate Zone, and approached me to see if I'd be interested in helping. Barney's a respiratory registrar. He'd heard me talk quite a bit about the climate crisis, and I'd been on an episode before, and so I passed the audition unknowingly. So there are now 12 episodes. We're on a break from making more at the moment because everyone's life got a bit busy, but there are 12 episodes that are fantastic that I'd really encourage people to listen to. They cover everything from the environmental impact of research, the effects of microplastics, extreme heat and heart disease, pregnancy outcomes and air pollution. And of course, there's an episode on plant-based diets for personal and planetary health. So
Brilliant.
it's important to make the information relevant and accessible to healthcare professionals and to show how strong the evidence is.
Yeah, and I know it's a huge area, but for listeners who are perhaps really new to this and don't really know very much about it, could you give us briefly a bit of explanation about how our diets do link to climate change?
Yes, it's not a very cheery subject, and there's quite a lot to say, but I'll try and be brief. So it comes down to the fact that we're really destroying Earth's natural systems at an alarming rate. We're causing the sixth mass extinction. We're destroying rainforest and ocean health, and we rely on them for oxygen and soil, and therefore our food. So it's an ecological emergency, and in addition, all the fossil fuels we burn collect in the atmosphere, create a blanket around the Earth, and heat it up. At our current rate, we will pass 1.5 degrees of warming and are on course actually to hit 2.5 to 2.7 by 2100. And this will surpass certain tipping points where the Earth essentially loses its ability to maintain homeostasis. And this brings really dramatic changes to life for every one of us and lots of deaths. So between 2030 and 2050, climate change is expected to lead to an additional 250,000 deaths a year due to heat, air pollution, malnutrition, malaria, diarrheal disease. But I think what people don't always realize is what a huge contributor to all these problems the food system is. Our food system is completely broken. We produce more than enough food for everyone who lives on the planet, and yet we have huge numbers of people living with diet-related ill health from both malnutrition and obesity. The way we produce food is very extractivist and industrialized, so it's destructive, it's inefficient, and it absolutely builds in cruelty to both humans who have to work in places like factory farms and slaughterhouses, and also obviously non-human animals who are sentient and want to live and don't want to live miserable, tortured lives. And even if we were successful at transforming our energy sector to renewables, insulating all our homes, massively reducing car use, transitioning to electric vehicles where necessary, if we did all that, if we do nothing about the food system, we will still breach 1.5 of warning. So it's essential that we act on the food system. Half of the world's habitable land is used for agriculture compared to less than 4% 1,000 years ago. So there's been a massive change in land use, which completely strips the land bare, drives habitat loss, drives biodiversity loss. Amazon deforestation, I think it's 75% of Amazon deforestation is due to animal agriculture because of the need for grazing and growing all the crops. And globally, 44% of all grain and 80% of soya is fed to animals. And we could instead divert that to human consumption. So, it's pretty bad, and we really need to shift if we're gonna try and protect our futures.
Yeah, and I think, for example, that's something I wasn't aware of, how important my dietary choices are to climate change. You think as an individual, what difference can what I choose for dinner make? But actually, it really can't it, when you add it all up?
Yeah, definitely. I think people do kind of think of it a bit, but they'll often talk about eating seasonally and locally, and that's all great, but we know that the biggest impact by far comes from what you eat. So if you compare the carbon footprint of foods, there's a great graph on Our World in Data, which I use a lot. If you look at the whole supply chain, so you include things like land use, production, processing, transport, if you compare the production of a kilogram of beef, this produces 99 kilograms of CO2 equivalents. If you produce 1 kilogram of rice, it's 4.5 kilograms. And if it's producing a kilogram of peas, it's just 0.98 kilograms of CO2. So it just shows you that not only is it different, it's like leagues different. So, there's just no place for consuming beef at scale if we want a livable planet.
Yeah, absolutely. And in terms of your interest with lung disease and air pollution, how do you think we can answer healthcare professionals who are not sure about what to advise patients or making their own changes? I mean, I speak to a lot of people and they say, oh, well, it's just too big. It's for governments, it's for policy makers, it's just too big for us to tackle. But actually, what could we suggest on a sort of ground level?
Things like air pollution do feel very big, and it's true that many of the changes that we need do need to come from the top, but they will only happen if we demand them and if we change the way we live. So the reason we have a clean air zone in London, and it's being expanded against quite a lot of opposition, is because the people who are affected are raising their voices and talking about how damaging air pollution is and how many times they've taken their 4-year-old to hospital with life-threatening asthma attacks, and what they see every day in the damage it's doing to their children or their relatives. So there are things people can do to reduce their exposure, and they're quite simple things like taking active travel options when they can. I think people don't realize that if you're sitting in a car in traffic, you're exposed to more air pollution than if you're walking on that same street or if you're cycling. So that's really key. There are things we can do in terms of deciding when we do our exercise, not on the highest pollution days. We do say to people with severe lung disease not to do strenuous exercise when it's the peak of air pollution, particularly on the hot, humid days. But obviously, they need to get the benefits of being out and about on other days. But really, this does require systemic change. It requires a reduction in the burning of fossil fuels. It requires infrastructure that means that people are able to make those choices in terms of walking and cycling. But without the voice of healthcare professionals and the voice of people who are affected, these changes won't happen.
Sure. And given our podcast is largely about diet and the health benefits of our dietary changes, can you draw out any links between plant-based diets and, say, air quality or climate change?
Yes. So the kind of pollutants that we think most about for health are nitrogen oxides, which primarily come from fossil fuel burning, and particulate matter, which again comes a lot from fossil fuel burning, but also from agriculture, particularly animal agriculture. And then ozone is another one. People will be aware of the impact of air pollution on the lungs, but they won't necessarily be aware of how much of it comes from animal agriculture. So if we just think about meat production, it causes air pollution at pretty much every stage of production. So there's lots of feed that has to be grown to feed the animals, and that's quite inefficient. So you have to grow a lot more crop per animal than if you just consume the crop directly. That requires nitrogen fertilizers that produces nitrous oxide, which is part of air pollution and has health impacts. Manure from animals releases ammonia as well as CO2 and methane. And of course, cows are ruminant animals and produce huge amounts of methane. And factory farms in particular produce absolutely huge amounts of particulate matter pollution. There was a study in the US where they tried to calculate just how many deaths might be caused from animal farming, and they calculated that the ammonia emissions contributed to 12,500 deaths a year. And they also did this interesting thing where they kind of calculated the per serving, the rate of air pollution linked to red meat was twice as high as that of eggs and 3 times as high as that of dairy, and at least 15 times as high as any fruit and veg. So again, the difference is really stark. If we just think about air pollution, animal agriculture and meat production is really bad for our health.
Wow, those are quite shocking statistics, aren't they? And I was completely unaware of that. So that's really useful to know. To summarise, what would you say would be the easy wins, sort of maybe 3 or 4 points that we could all adopt to help our planet, but also help our own health and reduce our, have cleaner air and reduce our carbon footprint, I suppose?
Yeah, I think the thing to remember is, although this all sounds quite shocking and terrible, there are lots of win-wins here. There are real co-benefits to any of these changes we make. So my first one would be take a step towards a plant-based diet today, then take another one, and then take another one, because the wins are huge. It's also very delicious. So that would be my first one. I think secondly, think about how you travel. So leave the car at home whenever you can. Make active travel your default. When I bought an actually effective rain mac, it transformed my life, and I now cycle almost everywhere, almost every day, because it turns out I didn't need a car, I needed a rain mac. And also, do you have to go to every conference in person? If it's abroad, do you really have to fly? Can you get the train? What does that mean in terms of days off? But just questioning your travel choices and forcing yourself to really think about whether there's a better option would be my second one. And then the third one is super easy, but not enough people do it. So I would say, look where your money is. So if you're banking with HSBC or Barclays or other big ones, but they're the 2 biggest, you're passively funding climate change breakdown because they give massive amounts of money to oil companies. So just fill in a form. You then press send and it's 1 click, and then you will switch your bank, and you should switch to either Triodos, Starling or Monzo. They don't invest in fossil fuels, or bonus, the arms trade or tobacco companies. And so you can stop passively funding these destructive industries.
Well, that's fantastic advice. Something we don't really think about, do we? You just sort of crack on with it day to day, and that's really good. And again, for the purpose of the podcast and the fact that we're talking a lot about plant-based health, you mentioned your number one being switched to plant-based eating. Can you give us your sort of 3 easy swaps that you maybe speak to patients or colleagues about, or things that you've just found in your plant-based journey that you've enjoyed?
Yeah, so I would say, first of all, make it fun. So I enjoy cooking far more now, and I'm much more adventurous, and I try new ingredients and cuisines all the time. So 6 years in, I'm still completely amazed by how many edible plants there are that I've never even heard of, never been tasted.
Yeah.
So I would really recommend that. My current favourite cookbook is Plentiful by Danae Moore. So it's vegan Jamaican recipes, and I'm like learning what chocho is and how to cook plantain and hearts of palm. So I would recommend that.
Lovely. Excellent. We'll have to check that one out.
My second one would be to find some favorites. So not everyone's, I don't have loads of energy to be creative every day. So you do need your go-to favorite. So if you really love chili con carne, try a few recipes that do swaps, and there are different options. So you might prefer soya mince or beans or lentils or mushrooms. I've tried all of them as mince replacements, and they have different pros and cons. So find one that really hits the spot for you, and then try with another favorite recipe. And then when you do that, you've got like a little bank of like easy, delicious things that mean that they're an easy win.
Yeah, I love that one, LJ. And I'd add to that, make a massive batch of it when you found your favourites, and you can freeze it in portions. And when you're back home after a long day, you just eat, defrost and eat, as it were.
So true. And my other one would be to use technology. So we have a rice cooker and an air fryer. And I have to say that they really make life easier, and they also make it more delicious. And an air fryer uses less energy, so that's a bonus. So I didn't eat tofu before I went vegan. Actually, my partner did, because he cooks a lot of sort of Japanese and Korean food. So it was just like a normal ingredient to him. But I had to learn how to make it taste good. And if you toss it in some spices and oil and put it in the air fryer, then it's automatically delicious. So
absolutely, I agree. I love my air fryer, don't I, Claire? I've already banged on about it, I think, in this podcast already.
You can't say enough about it. Keep going with
so
it.
Good.
Fantastic. Those are great tips. Thank you. Thanks, LJ.
Right, that leads us nicely on then. I can't wait to hear what you are having for dinner tonight, LJ.
Oh, that's such a good question, because I was thinking about this before we were talking. So we get a veg box called Odd Box. So it's a vegetable box that prevents food waste. So it's full of fruit and veg that's surplus for some reason. It's either like weird weather patterns have meant there's a glut of something, or the potatoes are too ugly, or the carrots are too small. So we have that. And this week we have some tender stem broccoli that we haven't yet eaten. So I'm going to do something with that. And I haven't decided yet. I'm either going to do a Thai green curry. There's a really good recipe in Bosch on a budget. Or I'm going to make a pasta dish with it, with some soy cream and nutritional yeast in the sauce. So I haven't decided which one I'm going to go for, but one of those.
Well, they both sound delicious, don't they? Enjoy it. Claire, how about you? What are you having for dinner tonight?
Yes, I've thought about this. I'm going to do sweet potato gnocchi. And that's because years ago, my Italian friend, her grandmother taught me how to make potato gnocchi. And of course, now being a plant-based health professional, I'm much more all about the sweet potato. So the sweet potato version is delicious. It's just roasting some sweet potatoes, mashing them up, adding some nutmeg, adding enough flour to kind of make so that you can make a dough that you can roll it into balls. And when you drop it into the water, it's done in about 2 minutes. And then you can put anything with that. I often just take some sage, massive bunch of it from the garden if you've got one, or a pot, and then chop it up, add a bit of garlic, add some pine nuts. And even tonight, I'm going to put a bit of asparagus tips with it. This isn't particularly budgety, but it's a quick meal and it ticks all the boxes on nutrition as well.
Sounds lovely. But do you have to make the gnocchi in advance then? Do you sort of do that?
No. I literally put the potatoes in the microwave for 10 minutes, and then you're supposed to let them cool and all the rest of it. But I tend to just sort of get on with it.
Okay, so not as time consuming as it sounds.
No, bit messy, but it doesn't take too long.
Bit of fun in
That
the
sounds
kitchen.
delicious.
And okay, so last but not least, it's Daisy. What are you putting in your air fryer tonight?
I think the air fryer's having a night off. I'm actually having the chili, which is why I mentioned it, LJ, when we were speaking earlier. I've taken out the the one big portion that we've put in the freezer. Yeah, we have a busy day, so it's one of those days where the pre-cooked meals have come in handy. But we do a massive bean chili, sort of once a fortnight actually, and just put it in the freezer for when we're having a busy day. And it's delicious because it's got, I don't know, 5-6 different types of beans. It's got peppers, onions, garlic, lots of spices. And it's really, really good even after you've defrosted it and or reheated it for the next day. So that's what we're having with rice, some sweet corn. And if I've got any avocados, I'll mash those up as well.
I think
Lovely.
often chili is better the day after it's been like sitting for a while. So that sounds really delicious.
Well, that sort of wraps up our episode today, and we'd like to say thanks once again for coming along, LJ. We've learned so much and lots of food for thought, actually, to think about and things to implement today. So we really appreciate your time.
Thank you.
Thank you so much. It's been great to speak to you.